Hello, my name is Nick Hanania. I'm a professor of medicine and director of the Airway Clinical Research Center at Baylor College of Medicine in Houston, Texas. I'm here to present our late-breaking poster at CHEST 2025 in Chicago. And the title of our presentation is Chronic Obstructive Pulmonary Disease Exacerbations Have Less Impact on Lung Function During Dupilumab Treatment. And these are pooled analysis from the BOREAS and NOTUS clinical trials. COPD exacerbation accelerate lung function decline and recovery and is often complicated even after acute event resolves. In the phase 3 BOREAS and NOTUS trials, add-on Dupilumab reduced moderate or severe exacerbations and improved lung function and quality of life in patients with COPD and type 2 inflammation, with safety results being consistent with the known Dupilumab safety profile. These observations prompted a focused question. Beyond lowering exacerbation frequency, does Dupilumab blunt the impact of exacerbation on lung function when they occur? So the objective of this post-hoc analysis of pooled data from BOREAS and NOTUS, we assessed among patients who experienced at least one moderate or severe exacerbation during treatment, the absolute and percent predicted post-bronchodilator forced expiratory volume, or FEV1, and forced vital capacity, FVC, across the peri, and post-exacerbation time windows. This was a post-hoc analysis of BOREAS and NOTUS. Both were randomized, double-blind, placebo-controlled trial enrolling adults 40 to 85 years of age with COPD, moderate to severe airflow limitation, and type 2 inflammation, defined by screening blood eosinophils more than 300 cells per cubic liter. They were all on background triple therapy. Participants received Dupilumab or placebo every 2 weeks for 52 weeks. For the present analysis, we selected patients who had at least one on-treatment moderate to severe exacerbation and had spirometry data available in the time windows relevant to the first exacerbation. That is, pre-exacerbation days minus 59 to minus 25, peri-exacerbation days minus 24 to 24 days, and post-exacerbation days 25 days to 59 days post-exacerbation. The reference visit was days minus 59 to minus 39. When multiple measurements were available within a window, the lowest value was used. Across the peri-exacerbation time windows, Dupilumab was associated with numerically smaller drops in post-bronchodilator FEV1 and percent predicted FEV1 before and during exacerbation, and greater improvement after the event versus placebo. As you see on the figure in the right panel, post-bronchodilator FVC and percent predicted FVC showed less impairment in peri exacerbation and more enhancement of post-exacerbation with Dupilumab. The overall pattern favored Dupilumab, less deterioration going into and through the event, and better rebound afterwards. So in conclusion, in patients with COPD and type 2 inflammation who experienced on-treatment exacerbation, Dupilumab was associated with trends toward less lung function deterioration peri-exacerbation and better post-exacerbation recovery compared to placebo. Clinically, this indicates a potential dual benefit for Dupilumab, fewer exacerbation overall and reduced impact on lung function for those in whom exacerbation continues to occur. In conclusion, what we have found is that the inpatient with COPD patients who have exacerbation, either moderate or severe exacerbation, and type 2 inflammation, the use of Dupilumab was associated with lung function that is preserved before, during, and post-exacerbation compared to patients who were treated with placebo. What that means clinically is that there may be a dual effect of Dupilumab, one in reduction in moderate severe exacerbation in this patient population, but also preservation of lung function during an exacerbation episode.